The content of this video is not medical advice or a substitute for physical therapy. Please consult your physician or physical therapist before starting any exercise program.
Did you know that your butt muscles, gluteus maximus back here, not your core muscles or your lower back muscles, are the ones that are meant to hold up the weight of your trunk when you're standing or walking around? The problem is that if you suffered from chronic low back pain, then in all likelihood, you are not using those butt muscles the way you should be. Now, this situation in recent years has been called dead butt syndrome. I know, I didn't make it up, but bear with me because we can reverse the effects. Now, you're probably wondering how this happened, so I'm going to give you a quick oversimplification. I want you to imagine that your brain and spinal cord are at the head of a giant circuit board, and that circuit board is in charge of all the various muscles of your body. And essentially, after you have injured your back, whether it's injury or surgery, maybe an abdominal surgery, or just poor posture over the years, your brain and spinal cord start unplugging some of the muscles closest to the spine and then rerouting their jobs to some of your movement muscles, the muscles that are really meant to move you through space. And what this effectively does is it stiffens you and kind of keeps you from further hurting your back. Now, the problem is that with all this rewiring, many times the buttocks get unplugged as well. And the only way you can get them back on is by going in and manually turning them back on. And that's what I'm going to teach you how to start doing today. We're going to manually turn them back on. Now, to be clear, if you go into the gym after watching this and start getting on some kind of butt blasting machine or doing 1,000 squats and lunges, you're just going to keep strengthening all those bypass muscles that your brain and spinal cord have been plugging in instead. So first thing we have to do before you start strengthening or doing fitness things for your butt is reestablish your on switch. So I'm going to give you 2 exercises today, super simple. You can start doing them right now, and you will probably start to get the happy results of using your buttocks when you're standing and walking. You'll probably notice it pretty soon after you start practicing these. So for our first exercise, we're going to make our way to the floor. And once you're on your back, just make sure that your pelvis and lower back are in a neutral position and head and neck are in a neutral position. And then you're going to take one knee up towards your chest, not so far that you are cramming your back down into the surface. So be sure your pelvis stays level and that gentle curve in your lower back is still present. Then you're going to straighten the other leg all the way down to the surface. Now from this position, what I want you to do is squeeze your butt cheek of the extended leg and then hold it a second before you release it. And we're going to squeeze and release that cheek about 10 times on this side, making sure you're really feeling that muscle activate and release. Now, this is not meant to be a strengthening exercise. Please remember, what we're trying to do is reestablish your on switch so that we get the buttocks back on that circuit board so the nervous system can recognize them and use them when you're standing and walking. So we're just squeezing and releasing here, pretty simple, pretty straightforward. When you're done with your 10, you're going to bend this knee, place the first foot back on the floor, and you're going to assume the same position for the other side. Once again, make sure you're not cramming your back down into the floor. You've got this leg fully extended, and then you're going to squeeze and release the butt cheek here on this new side. Again, once you're done with your 10, we're going to transition to a more upright position, which mimics what the butt should be doing in standing and walking a little bit better. You're going to take one leg forward, and this front knee will be positioned over your heel, your back knee under your hip. Now, if this is a huge hip flexor or quad stretch for some of you, you can kind of bring your foot here a little closer to your knee, and you see that bends my hip a little bit, so it takes some of the intensity out of that stretch. So you can absolutely modify this a little bit if you need to. Be sure your pelvis is relatively vertical, especially if you know you tend toward more of the duck-tailed type posture. Let's see if you can get your tailbone to point more down, which should give you better access to squeeze this buttock. So just like in the first exercise, you're going to squeeze the butt cheek, hold it for a second before you release it. We're going to do 10 squeezes like this, and then I'll ask you to switch forward legs. Again, make sure the pelvis position is more vertical, and then you're going to squeeze and release the other side. And feel free to hang on to something while you do this. This should not be a balance challenge. So once you're done with your 10, stand up and see how you feel. You should feel like your hips are a little more open and there's more activity going on back here. Maybe your trunk feels a little bit lighter even. But definitely over time, if you practice a few of these daily, you should start to see a difference in how you're able to hold yourself up. So that's it for our tip for today. If you like this content, please go ahead and click all the buttons. Make sure you subscribe to our channel. And if this is really resonating with you and you want to go deeper, please check out our Rebuilding Your Back Academy, which is launching soon. We've got some great free webinars coming up. So certainly look around on my site and sign up for that free webinar if you want more information. So until next time, keep moving and be well.